Yes, I would like to thank the organizer for the opportunity to present our work on predicting no-show appointment in a pediatric hospital in Chile. Let me first introduce the situation in Chile regarding no-show of patients. So, public healthcare system in Chile is very important. Actually, it serves 75% of Chilean population, but despite its good technical level, it has significant management inefficiencies. For instance, 90% of the appointments are missed due to the no-show of patients, and it's very heterogeneous in terms of institutions. Some of them reach peaks, high peaks, up to 28%. What has important consequences such as economic losses, increase of waiting list, risk to the health of patients, among others. In contrast, in the private healthcare system, average no-show rate is around 15%. That's why the Chilean Ministry of Health has demanded that public institutions reach lower levels from 10 to 15%, which can be difficult to reach for some institutions. Of course, different solutions exist, calls, automatic call centers, text messages, etc. But even if these methods can be efficient in practice, they can also be expensive if we apply them to all situations. Hence, our approach consists of identifying appointments with a high probability of being missed by using machine learning techniques, but in a cost-effective way. That is, we try to reduce the quantity of suggested action, for instance, call, that's the cost, of course, but without jeopardizing the no-show reduction. For this, we introduce an appropriate metric, which is used to choose the best predictors for each medical specialist study. This metric is given by the recall divided by the proportion of suggested actions. But for the sake of time, I have only 10 minutes. I avoid all the technicalities here. So after calibrating and choosing the best predictor, an informatic tool was created and deployed. We really believe that this is especially relevant to the healthcare institution with limited budget, like most Chilean healthcare public institutions, including our case study that we present now. So, Hospital Dr. Luis Calvo Maquena is a high complexity public health institution located in Santiago, capital of Chile. It is in fact the most important pediatric hospital in Chile. Actually, this hospital is a national reference center, therefore it cares for children from all over the country. Consequently, our results may affect and hopefully improve the quality of life of the most disadvantaged children in Chile. Approximately 90,000 medical appointments are attended per year, and as a part of this project, we have studied 23 medical specialties. Actually, the no-show was very heterogeneous with respect to the specialty, which is consistent with the no-show literature. This justifies our decision to create a predictor for each medical specialty. Calvo McKenna reports an average no-show of 21%, and let me tell you the story from its end. After the first month of using our web platform, they reported a decrease of approximately 3%. Thus, I would to analyze this project and its impact more carefully in the next slides. Regarding the content of the project, first, it is worth saying that this was a transfer project, not a research one. This took place between October 2018 and March 2019, when the web platform was installed in the hospital. To create the predictor, we had access to a data set of approximately 600,000 appointments from years 2015 to 2018. So to construct the predictors, we use the features you can see on this slide. The left-hand column contains features associated with appointment. So the type of appointment, if new, routine appointment, or derived from primary healthcare, month, day of the week, hour, and reservation delay, which is the number of weeks between the creation of the appointment and the appointment itself. The right-hand column contains information about the patient, age, sex, commune or district of residence, medical insurance, and two historical variables related to the percentage of no-show of the patient. The first one is general, and the second one is constructed with respect to the studied medical specialty. Let me recall here that the medical specialty is not a feature because our predictor, we have a predictor for each specialty, right? So each specialty has its own predictor. On this slide, we show the correlation for each type of feature. You can see that the most correlated appointment variable is reservation delay. So unsurprisingly, if the appointment was created the same week it occurs, then the no-show is less likely to happen. Regarding features related to the patient, the historical ones are the most positive correlated. Well, you can see the rest in the slide. Regarding the when we analyze the predictive strength of each feature, the general historical no-show is the most predictive, followed by the delay in the reservation, the commune of the resident, in this case a particular one, Peñalolén, and the insurance group A, which is associated with the most disadvantaged people in Chile. The latter is consistent with the no-show literature as well. Now, in the context of an ongoing research project, we analyze the performance of the web platform during its use in the hospital. So for this, we have obviously incorporated information from year 2019, and we can see first a significant decrease in no-shows during the first month of use of its use compared to the previous month. However, it was not clear to us at this point how the sessional behavior of the no-show affects this decrease. Then we have plot no-show for the last 5 years. The blue line denotes year 2019. And with respect to the previous year, we can see an important impact here in April, the first month of use, but a less significant reduction in the coming month compared to 2018. Perhaps the big peak at October has caught your attention, right? It is because huge social demonstration that took place in Chile in that period. This led to a very unusual no-show profile at the end of the year. Consequently, we have preferred to discard that part of the year for our further analysis. Then, in order to compare with a situation without any intervention, we have simulated the no-show rate without intervention using a Sarima model and data from previous year. This is represented by the red curve, and it's 95 and 90% of the confidence interval is plotted here as well. If we zoom in on this area, we can see more clearly a reduction in April, but also in July and August. The nominal and relative reduction of no-show appear here in the table to the right. Lastly, regarding the performance analysis for each medical specialty, I would like to show how our predictors compare to real performance. Among the 23 medical specialties analyzed, we performed very well in 10 of them, in the sense that we predicted our prediction were actually exceeded by the real results. In 9 of them, we have a reduction of the no-show, but it's less important than what our analysis suggested. And in 4 of them, we didn't get a reduction. So I'm running out of time, so I just want to say that we have 2 years of project now, 3 other hospitals are involved, and our next stage is to assess real efficiency of different mitigation actions in real situations. Thanks, all the credit of this work goes to my team, what can be seen in this slide. Thank you very much.